Good afternoon, everybody out there in Facebook land. Welcome to today's Facebook Live event, where we are going to continue talking about the COVID vaccine. Today, we're going to continue to educate one another and share important facts about the vaccine, as well as give you all information on how you can get it and what you can expect once you've gotten the vaccine. For those of you who I don't know, my name is April Verrett, and I am the proud president of SEIU Local 2015. And I am joined by one of my partners in crime, Executive Vice President Dereck Smith, as well as a special guest. Today we have Dr. Susanna Maggie and our very own Christina White, an amazing nursing home leader from Region 3 in Kern County from Bakersfield. We are super excited to be able to hear and share stories of so many of our members who have had the opportunity to get vaccinated. More and more, I am hearing from you all. April, I got the shot. April, I got the shot. April, I had shot 1 today, or I had shot 2 last week. Keep it coming. I love hearing from you all about how it's going, but more importantly, that we absolutely can do it. I would be remiss, however, if I don't take a second to talk about what is happening in Washington, D.C. We are happy and proud to say that the U.S. Congress passed the American Rescue Plan this past weekend, and the House version included a $15 minimum wage for all Americans, right? And we have heard the rumblings that the parliamentarian and the Senate said that they couldn't do it. We are not trying to hear it. We are pressing forward. Just as we made sure there was a $15 minimum wage in the state of California, we are not going to stop until we help pass a $15 minimum wage for every man, woman, and working person in this country. It is not, we are never going to go back, right? The old ways, the old status quo, including poverty wages, wasn't good a year ago, and they're damn sure not good enough as we have survived 2020. And so that taught us that we can stand up and fight and persevere through anything. And we are going to continue to raise our voices and demand a $15 minimum wage for this country. It's a National Day of Action today. So if you have not had an opportunity to participate in an action yet, I want to encourage you to do so. The fight for 15 is real, and it's here, and it needs all of us to continue to fight. So back to the vaccine. So we know with the approval of the Johnson & Johnson version of the vaccine, we will hopefully see a boost in the rollout. I heard today that the president is now saying that there'll be enough doses of vaccine to cover every American by May. Fingers crossed that can happen. And so we want to make sure that as this vaccine becomes more available, that it's not just available in the communities that have been the ones that have been getting the vaccine to date. We are going to make sure this vaccine distribution is equitable, that we lower the barriers, that we fight through the hesitancy, because what good is the vaccine if we can't get an appointment? What good is the vaccine if I got to travel over the hill and under the mountain and through the bridge to get, right? We got to lower the barriers. We got to make sure the vaccine is available in our communities. That's our fight. Can we do it 2015?
Yes, we can.
Yes, we can, Dereck said. Can we do it, Dereck?
Yes, we can.
So we are all excited about the Johnson & Johnson vaccine. I'm with you, Carmen Chavez. And we launched here in 2015 our very own We Can Do It campaign, where we are lifting our voices, encouraging our members to get vaccinated, that we are making sure the members of our community get vaccinated, and that we are making sure we rebuild and we strengthen our long-term care system so that we never, ever, ever have a vulnerable system the way we did a year ago. And so we know that we have the full force of the members of 2015 behind the We Can Do It campaign. And what?
We win.
When we fight,
We win.
because we are a force of nature. And this Facebook Live event is being held as a part of the We Can Do It campaign. And as we seek to defeat and break the back of the COVID-19 virus through promoting mass vaccination, and like I said before, rebuilding our healthcare and long-term care infrastructure. We're going to use this time together today to do two things. First, we want to create the opportunity for you to hear from trusted voices that can talk about the safety, the side effects, the differences between the vaccines, right? We know we have to educate ourselves. And we're going to, as I said, talk more about opportunities and access to the vaccine so our members can know where they can get it. And also, we're going to hear a story from our very own Christina White about her own experience in taking the vaccine. As care providers, we know we're eligible through the state of California. That hasn't changed. I know there's been some changes in how the vaccine is distributed, but it has not affected the eligibility of 2015 members. And now our consumers are, for the most part, available to receive the vaccine as well. So tell me, Dereck, how are you feeling about We Can Do It in the rollout?
When I think of, great question, April. When I think about the rollout, I know there's a lot of work to do, but yeah, we can do it. So as we think about the vaccine and the vaccine education and rollout, we must keep the most vulnerable communities in mind, especially those that have been adversely affected by the virus. There are several things we must do. One, we need to target the most impacted communities. The vaccine distribution must be equitable and transparent and must prioritize communities hardest hit by the virus, including essential workers, people with underlying health conditions, and disproportionately impacted communities of color. The best approach to encouraging universal vaccination is through education and outreach, which is what we're trying to do today. And number two is we must consider geographical equity and establishing enough distribution centers that expand the scope and accessibility of the vaccine for caregivers and communities. Vaccine must be provided free of charge, and workers should be provided with a paid time off if the vaccination process requires them to miss work. And three, we must continue to urge employers and government agencies to organize and facilitate the distribution in a way that instills the utmost confidence in the vaccine. Outreach and distribution plans must recognize the impact of structural racism and historical inequities in healthcare and causing heightened levels of distrust about vaccination in Black and Brown communities. Employers must not use the vaccine as a substitute for workers' safety and infection control protocols, nor for not ensuring access to personal protective equipment. And on a local level, we have to continue to work with our board of supervisors to work on solutions to improve the rollout of this vaccine.
That's right, Dereck. We have to hold our elected officials accountable and partner with those who share our vision for an equitable distribution of this vaccine. Like all of you all, we have been hearing the reports about how hard it's been to get an appointment for the vaccine. That website, man, what I hear is that it is a beast, and that in some counties, there's just simply not enough locations for people to get to where the vaccine is being distributed. And not to mention that we know we see people who we don't normally see in our neighborhood at the places where we are supposed to have access to the vaccine, right? People are all of a sudden coming from Calabasas down to South LA. Well, we have to do what we can do to help change that. The burden shouldn't be all on us. We have to make access to this vaccine more easy, and we have to, again, lower the barriers. So that's why it's important that 2015 does its part to encourage and support the normalization of the mass vaccination. It should not be, oh, I don't know about that, right? It shouldn't be if you're going to take it. It should be, when am I going to take it? And I know that's not easy for many of us. A lot of us still have doubts. A lot of us still have questions. There's a lot of fear, but don't worry about it. That's what Team 2015 is for. We're going to talk to you about your doubts. We're going to share with you information from experts about your fears and your concerns so that you go from, I don't know, to we can do it. Ain't that right, Dereck?
Yes, we can.
And most importantly, we're going to make sure our communities are prioritized. It's been our communities that has suffered the most through this pandemic. And so we should be the ones at the front of the line to get the vaccine. We've dealt with all of the hurt. We've dealt with all of the pain and the uncertainty. We've had to mourn those that we've lost. Now it's time to save lives. And we got to make sure that the lives in our communities can be saved. It's always poor folk and people of color who have been desperately impacted by this virus. And it's time to put ourselves first. And we are going to ensure that we are not left behind. And we know that 2015 can be a trusted voice to help combat the skepticism and the reservations about this vaccine, as well as demand equitable access and transparency from our employers, from corporations, and from the government to ensure fair distribution. So enough of my yickety yakety yak. Let's get started. I'm super excited about our guest. I'm proud to introduce Dr. Susanna Maggie. She is an infectious disease physician and HIV researcher at Duke University. Thank you so much, Dr. Maggie, for taking the time to be with us and to share your expertise and to help set our fears and uncertainty at ease. I'm handing it over to you.
Thank you, April. It is great to be here. I'm thrilled to have the opportunity to talk with everyone and hopefully address some of your questions, because I know this. I take care of veterans every day, and I take care of patients every day. And I know that these are concerns, and I love having one-on-one conversations with my patients, with the staff that I work with, to try to relieve some of these fears. So I think just to start, and I'll just start talking until the slides come up, but just to start, I think for all of us, we have a goal of getting back to our normal life. And in order to do that, and really in order to stop the spread of this virus, and I saw some questions coming up, the concerns about the new strains, et cetera. In order to get that under control, we really need to ensure that this virus can't continue to spread in our communities. And in order to stop that spread, we really need to have a large number of our community members vaccinated. We all have a part to play in this. If we don't have a significant number of us reaching the vaccination, kind of endpoint, then we will continue to have this virus spread. So you can go to the next slide, which just shows you that depending on the level of vaccination in population, particularly for a virus like SARS-CoV-2 that spreads, this virus is very good at jumping from one person to the next. We really do have to have a pretty high level of coverage. We estimate somewhere up into the 90% range of people who have been vaccinated and therefore do carry immunity. So I don't know if you guys can see the slides advancing or not. I am not seeing them advancing. And
I see them, they're advancing now, Doctor.
There you go. All right. So this slide shows you that in yellow are the groups of people that are vaccinated, and in blue are people who are not. And I think if you move the slide forward, you'll see that you can see spread of this virus very quickly when you have a very low percentage of people who are vaccinated. So, this is why it's so important for all of us to get back to our lives in a way that we want to, and for us to protect ourselves, our family members, our loved ones, those that we work with in our communities, is to get this vaccine. So that there are many different types of vaccines, right? We're all used to the idea of having a flu vaccine or a tetanus vaccine, and now we're talking about a COVID vaccine. I highlight here a couple of the different types of vaccines. The two first COVID vaccines that were approved, as you know, are what we call mRNA vaccines. And these to some people are novel. It's the first time that we've had a vaccine approved or at least authorized by the FDA. But scientists have been doing research with these vaccines and with mRNA for a very, very, very long time. So the technology itself is not new. We understand it actually quite well in humans. But this is the first time that we've had one move forward into humans in the clinical space. And in fact, I got my Pfizer vaccine back in December as a healthcare provider. Everyone's talking about the J&J, very exciting that Janssen & Janssen was just approved. That is a viral vector vaccine where we use what's called an adenovirus, which is actually a virus that technically can infect humans, but this virus cannot. And we use it as a way to carry that RNA into our body so that our body can make this protein. And it's a way for our immune system, the way that we fight infections, to recognize that protein without being infected and then fight it off when we do see it. What I'll tell you about the ability for these vaccines to protect us and prevent infection is they're quite exceptional. All three of these are better than the flu vaccine. As you've probably heard, Moderna and Pfizer have an over 90% efficacy, which means that they protect against infection by 90%. And even better if you're looking at severe infection, ending up in the hospital. The J&J vaccine has a ability to prevent infection at about 66%. So that might sound a lot worse, but the reality is to prevent severe infection, which is what really matters, keeps us out of the hospital, keeps us from getting really sick, it was 100%. So these are all great options. And there are some differences here. The J&J vaccine can be kept in a refrigerator for up to 3 months. This is going to be critical. I see lots of people saying it's hard to get the vaccine. Is there going to be a drive up so I can get it because my child doesn't want to be around other people? This is going to be critical to having a vaccine that's stable and that we can get out into communities safely and that it can be stored for a long time in a refrigerator or at a site where you're doing some drive up vaccines. Next slide. I also know that I saw a lot of folks voicing concern about the safety profile. And the safety profile for these vaccines, if you can, I think there's just a little bit of a delay. There you go. So just to kind of put this in perspective, because I know a lot of folks have voiced concerns about safety. And I know a lot of folks have voiced concerns about the fact that these came through so fast that we must have cut corners. And I think what I would say is that, believe it or not, even the federal government can move quickly when it needs to. So there were no corners cut here as it relates to safety. It was mostly that a lot of the red tape that's required to get things through was removed because this was a national disaster from a public health perspective, and we really need to move this through quickly. But from a safety perspective, no corners have been cut. And what this shows you is the Pfizer vaccine, for example, about 1 in 4 people will have some reaction to the vaccine. Not a deadly reaction. No one's died from this vaccine, but a typical reaction that we expect to see from vaccines. You can see here that the shingles vaccine is actually one of the vaccines that has the most side effects. I'd say the COVID vaccines are probably somewhere between the shingles vaccine and the flu vaccine when it comes to you having some symptoms from your vaccine. I can tell you that when I got my second dose of the Pfizer vaccine, I had some pretty significant achiness and chills for about 12 or 24 hours. And then it was gone and I got better and went back to work. So this is expected. And in fact, I think is something that helps us know that our body is responding very robustly to developing that immune response. Because the reason we feel like we have the flu when we get the flu is actually our body's immune system responding to the virus. Next slide. So the other thing I think that has been talked about quite a bit as well in the press is the concerns about having a severe allergic reaction. You know, allergic reactions occur from medications, they occur from foods and other exposures, and it's no different for a vaccine. Right now, we're seeing that about 2 to 5 people per 1 million may have an anaphylactic reaction, which is a severe allergic reaction. No one has died from this. And so it's, again, I think this is something that happens. It's, you know, when someone gets a dose or a shot of penicillin, they're much more likely to have an anaphylactic reaction than you are from getting any of these vaccines. So I think put it in perspective in terms of the safety, because I think we all view penicillin as pretty safe. Next slide. So I think I noticed that a number of folks were talking about these new variants, these new strains. You know, viruses are very, very smart. And when there are a lot of people in the community who are not immune, they can change and adapt to their environment very, very quickly. And this is expected of viruses. Every virus I've ever worked with does this. And I think a lot of folks have voiced concerns about whether the vaccines will still work in that setting. And the answer is, right now, we see that the vaccines still work. Do they work as well? Maybe not. But probably to prevent hospitalization and dying from this infection, which we know many, many hundreds of thousands of people have done in the United States, we believe that, in fact, they will continue to protect us from requiring hospitalization. It may be that with some of these other more novel mutations, that we may see more people get the actual infection and develop symptoms, but probably not to the point that they're requiring hospitalization. So I think that's a big point to make. Next slide, please. I'm just going to pull up my additional slide set because this is a bit slow in terms of there you go. So I've heard a lot of folks talking about the concerns that many people in this country and beyond have a lot of concerns about the safety. And you can see this slide here that back in June, there were a lot of people who were voicing concerns and saying, even if a vaccine does come out, I am not going to get it. And you can see that the primary concern here is that the majority of people who said, I'm not willing to get it, are people from our underrepresented and marginalized communities. And this is a real problem because those are the same communities that we know have been very hard hit by this virus. So the very people that we want to prioritize for getting access to this vaccine are many of the same folks who have a lot of concerns and I think appropriate lack of trust for this sort of thing. And so we need to educate each other about the safety. And we need to work with our community outreach groups and our health departments and community health centers to make sure that we're getting this vaccine out to all the people who need it. So I think just for the sake of time, I am going to close this up on the next slide. I think, you know, as you heard, I work at Duke University. We have a study that is enrolling people who work in healthcare, like yourselves, so that we can actually track and understand how this pandemic has affected you, your life, your family. And in addition, we have the Hero Together study, which is actually tracking how people are responding to this vaccine. What types of symptoms are you having? The nice thing about this, if you go to the next slide, is that it actually will be able to report back to you. What are some of the symptoms that people are having that are in your community, that are in your region? So that you understand how your response to this is the same, most likely, than most other folks that are in your community, in your state, in your region. So we'd love to have you come and join the HERO research study if you are interested. And I put up here how you can do that, which is based on it's actually you can log in through your smartphone or your computer and share with us how you feel after you get the vaccine. So I'll stop there, and I'm not sure if there's time, but I'm happy to take questions at any point if there is.
Thanks, Dr. Maggie. Really, really helpful, useful information. So just one question before we go to Christina. I'm wondering if you can address some of the, let's call it urban legend, that is out there in the world about the vaccine, right? I've heard everything from they are injecting you with live virus so that they can, depopulate the earth, and to, you'll be injected with GPS trackers. What they're really trying to do is duplicate your DNA, right? We've heard a lot of stuff, but it is driving the fear, right? Driving the concern that people have. So can you just address some of the myths that you've heard about the vaccine?
Yes, I've heard all of these. And I have these conversations with my patients because they bring them to me. Mm-hmm. And what I will say is, so one is that when they are giving you this RNA vaccine, it is not getting into your cells where it can change your DNA. Absolutely not, 100% not happening. In fact, RNA is actually natural to your body. it doesn't last very long. Your body actually degrades it and gets rid of it very quickly. And it doesn't in any way involve your DNA, which is your genetic makeup. So no, definitely no trackers, nothing, no chips, nothing like that. Scientifically, I don't think we've gotten there yet, and certainly not through a vaccine. But I'm sure there are movies that you can see that do that. And I think the other question, April, that the big one that you said was, it was the trackers and the chips and DNA. There was one more.
And it's all about, depopulating the earth.
Oh, right. Yeah. No, I mean, look, again, this gets to the fact that these are scientists. And I know some people have a hard time trusting the medical community. I understand that. I think many in Black and brown communities have a historical reason for that. Bottom line is that as scientists and as doctors, we care for every single one of our patients, and our job is to heal, not to hurt. And there's none of the scientists that are working on this are doing this in any way to hurt anyone. In fact, they are heroes for bringing these forward. They're likely going to win a Nobel Prize because of the number of lives that they will have saved by bringing these vaccines forward so quickly.
Great, thank you. Dereck, you got a quick question before we go to Christina?
Sure, I have a quick one for you, Dr. Maggie. Should I take the vaccine if I already had COVID, and how long should I wait after the infection?
That is a great question. The answer is yes. And the reason is we don't know how long your immunity. So how long are you protected with your body's memory if you've been infected? Right now, the CDC says, let's assume it's about 3 months. Because there are studies that say that you see the antibodies go up after the infection, and then those antibodies slowly go down. Those antibodies are our body's memory of how to fight this virus. So yes, you should get it, but you can wait about 3 months if you want to, particularly if it's hard to get in. But we would say definitely make sure you get in there by about that 3-month period to get your vaccine, to make sure you get that level back up again.
Right. Thank you, Dr. Maggie, and thank you for all the great information you provided today. So next, I want to introduce Christina White, a member of SEIU 2015. She worked as a CNA in a nursing home in Bakersfield, California. She's an executive board member, a steward in her facility, and a fierce organizer. I can go on and on about Christina, but I'll just let her tell you about herself and her story. Christina?
Thank you, Dereck, and thank you everyone for having me. I'm excited to share my experience with the vaccine. For the last year, I've been working tirelessly throughout the pandemic in my nursing home. I was lucky enough to get the vaccine in my facility with my coworkers. We talked about getting the vaccine before we knew it was coming out and it was going to be our turn to get it. And we talked about it. We encouraged one another. So in the beginning of January, I got my first dose, and we did it in groups just to help support each other. We did in groups. We checked on each other throughout the day, and by the end of the day, people that said they weren't going to get the vaccine, it was like a domino effect. They ended up getting the vaccine. So we were very proud and happy for them. And in between the first and second dose, we just checked on each other. We, encouraged each other. We were there for one another. And we got through it. And it was a sigh of relief when you get your second dose. It was a relief, and we're thankful we did it. We did it for our families. We did it to help stop the spread. And our residents, too, were proud that we got it. And they felt a little more safer knowing that we, did what we could, get the vaccine. And there was mild side effects, only 24 hours to 48 hours. I only had a sore arm, which many other only had sore arms. So they were very mild. And we're all grateful, no regrets. Nobody regrets getting it. And we're all happy that we got the vaccine.
Great. Thank you, Christina. Thank you for sharing your story about yourself and your co-workers with us, and for always being an inspiration and a leader in your facility. This is exactly why we've launched the We Can Do It campaign. Our campaign signature art, our campaign signature artwork. Carmen the caregiver pays homage to Rosie the Riveter, the World War II icon who symbolized American women who went to work in factories and shipyards to replace men who had joined the military. And today we are revealing our latest artwork. Today we are launching several new art pieces.
Those are great.
Great.
How cool.
Those are just some of our new artwork, work pieces in different languages. We know we have a long road ahead, but we can return to some sense of normalcy if we work together to create a better future. Right, April?
That is absolutely right. There is something that each and every one of us can do. We can all make sure we get vaccinated, right? If you have not gotten your vaccine yet and you need more information, contact the union. We can help you get vaccinated. You can encourage your family members to get that shot in their arm. And right now, you can go to www.seiu2015.org/We Can Do It to take the We Can Do It pledge. Again, there it is in the chat, www.seiu2015.org/We Can Do It, where you can take the We Can Do It pledge, as well as find other ways that you can be active in the campaign to prioritize the vaccination and equitable rollout, as well as take other action in your union on the state budget, upcoming contract campaigns. There's also cool social media, artwork and creative up there, your Facebook frames, other resources for you to learn more about the vaccine. And the last thing I want to remind you all of, we are a union that's about taking action. We Can Do It is about taking action. And this Friday and every Friday, we will be calling on elected officials to stand with care workers. So call Congress this Friday. Ask your representative to invest in home care to support seniors and people with disabilities, as well as essential workers. Fridays are our call-in days. And so we need you all to continue to raise your voices each and every Friday. So that's it, Facebook folk. We don't want to keep you any longer. Thank you all for joining us today. I hope you all learned something. I hope some of you who were listening, you moved past whatever was holding you back, and now you're ready to get the shot in the arm. If you need me to help you figure out how to get that shot in your arm, don't forget www.seiu2015.org/We Can Do It. Because when we fight,
we win.
We can do it, Dereck Smith.
Yes, we can.
All right. See you all soon. Bye.